Welcome to Keeping You in the Family with Dr. Margaret Aranda on the Caw 360 Network. And now, Dr. Margaret Aranda. Dr. Aranda, you're going to have to turn your microphone on because you're not coming out.
Hi, this is Dr. Margaret Aranda. I hope you guys are all doing great today. I'm very excited to talk to you about something that really makes a difference with pain. It's something that a lot of doctors don't talk about, maybe because they don't really specialize in it so much, and that's your diet. The reason why I think it's so important is because your body's inflamed, and inflammation is really the cause of a lot of pain. So I wanted to start off by giving you some hard science about pain and inflammation and injury, because if you understand that, then you'll understand why food is so important to you. And I hope it makes a lot of sense. Brian, I'm ready for the first slide. A lot of people had an injury that caused their pain. And that could be something congenital and anatomical about your actual body, or it could be an injury or a trauma or a surgery and complications from that. So the acute phase of inflammation is something that's extremely important because that's how your body's going to heal itself. So in the beginning, when you injure yourself, you might bleed. That causes a lot of platelets to come in to stop the bleeding. That makes sense, right? So when they're activated, then your body can coagulate or clot, and that also sets up a whole big cascade of other molecular reactions that go into effect. And actually, you can see from this slide at the bottom of it that the acute stages of inflammation start at time 0 and go to the first 10 days. And the scale of this is for almost 1 year. It's 300 days. And many patients that I know, and I was in the same category, end up with flares about once a month. So then you're re-injuring and getting back to that acute inflammation over and over again. From days 1 to 30, you've got cell proliferation and the matrix deposition. You've got new blood vessels that are trying to restart, perfusing and providing blood and oxygen to that area. You've got reepithelialization, which is when the skin is going to replicate itself to scar or to close a wound. And then you've got collagen, fibronectin, proteoglycans. All these things are really important that are needed. Your body's searching for them and gathering them and sending them to that area. And then again, from days 1 to 300, your extracellular matrix is going to continue to synthesize new healing tissue and degrade it and remodel it again. That's how scars disappear. So the strength of the remaining tissue may be stronger and fibrotic. It also can have fewer cells in it and less vascularity because fibrosis doesn't need a big blood supply. So a lot of things happen in this category, and you can see that it's a little bit on the complicated side. Once you have a particular part of your body that's inflamed, and then you keep re-injuring it, you're going to be using up all these factors over and over again. And you can go to the second slide, Brian, because these are some of the things that I actually test for. The interferons, interleukins, you've got tumor necrosis factor, you have SED rate that goes up. All these labs, we can check your blood and see cytokines and all these other substances. Substance P and glutamate may sound familiar to you. Those are involved with pain. And it's all really, really complicated. And it actually is establishing healing through the matrix, signaling factors, and enzymes. So again, you can picture yourself re-injuring yourself over and over again and having to go through this all the time. So your body is inflamed. If you have pain, you're in a state of inflammation. The organ systems that get involved with this are many, and that's because most people aren't exercising very much. They're not utilizing energy. They're not gaining muscle mass. You can't work out, obviously. A lot of people are bedridden, sometimes for days, weeks, months, years, decades. I know what that feels like. Your muscles atrophy, you lose strength, you get weak, your total body fat increases, and that causes another problem because fat is an organ. If your waistline isn't tiny, if it isn't small, then it has a lot of fat in there, much more than you would think. It's not just under the skin. The fat that's in your abdomen, especially like if you don't have a smaller waistline, if your waistline is straight down, that's not quite so bad than if your waistline goes like a donut. And I know some people that like donuts, especially jelly donuts. And you can still do things like that, eat something like that, but it's got to be a treat, not a daily thing for most people. So when you have that much fat and your abdomen is large, that is called abdominal adiposity. When you have abdominal adiposity, it leads to prediabetes, diabetes. You have fat. It's not just under the skin. It surrounds your intestines. If I was to dissect that and open it up, you see a lot of yellow fat globules all over the small intestine, the large intestine, surrounding the adrenal glands, the kidneys, and guess what else? The liver. And your liver is super important because you need that to detox. And so if you get a fatty liver, that ends up putting you in still another area. And there is non-alcoholic fatty liver that is from high fat content in the abdomen. So prediabetes, chronic metabolic syndrome, leads to heart attack, stroke, low back pain. I mean, you make your back pain even worse if your stomach muscles are really weak. And if you have a lot of weight that you're carrying in your abdomen, it's going to throw your spine off too. And imagine how much better you would feel if you lost 10 pounds, 20 pounds, 50 pounds, 100 pounds. Your heart's not going to have to pump as hard. Your body is going to be more rested. And you'll probably live longer too. So everything that we're talking about isn't just to say you weigh too much, you're fat, okay? It's to say that food is medicine. And if you have pain and if you're inflamed, food, every bite that you eat is going to either help you or hurt you. And if you get in the habit of eating food that are going to reduce your inflammation, your pain is going to go down. And I'm sorry that a lot of doctors don't talk to you about this, and I'm usually the first one to say it like this to many people, but I'm going to explain a little bit more to you too. In the way that I had to experience all of this myself, I went through a series of 3 diets, and that's what I recommend for everybody, pretty much almost everybody, unless you're already on a restricted diet because you have a metabolic problem of some kind. So the first one that's really easy to do is to make sure you're not inflaming yourself every time you eat. So you could come to me, you could go to another doctor, and you could get allergy testing, all those little polka dots on your back and what turns red and what doesn't, you can save your money, because the better thing to do is to eat down or give away the food in your house, the bad food that you're really not supposed to eat, fatty food, processed food, anything that you don't recognize all the contents on it if you read the ingredients. Okay. And then the first thing that I recommend is that people go on what's called a Whole30 diet. It's WHOLE 30. And Brian, you can give us the next slide, please. This is a well-ingrained program. It is called an elimination diet. It eliminates everything that you could be allergic to, including dairy. And you're allowed to eat everything that's on the list. You're not allowed to eat anything that's not on the list. You have to plan your day, learn about it, read about it, set a time that you're going to do it and a day that you're going to do it, and you're going to do it for 30 days. Even if your brother's getting married, you can't eat his wedding cake. You can't cheat one single time. And to support you in this effort, the Whole30 organization has a really nice support network and a forum that is used to doing this. They've been doing this for 15 years, and it's free. Okay? So 95% of people lose weight in the first 30 days. So build your support network, let everybody know you're going to do it. Get your house ready, get rid of tempting food. You're not going to have ice cream in there. You can have some more later. And there's even a Whole30 coach. And number 7, toss the scale. Don't, just obsess about what your weight is every day, twice a day. You don't need to do that, because 95% of people on this diet lose weight in the first 30 days. And I'll mention here too that the Whole30 is not a Whole31, and it's not a Whole365. This is not a diet for life. We can give you a diet for life, but this one is not it. This one gets you pointed in the right direction. It starts changing your total body composition. And number 8, you just decide when you're going to do it, and then do it. So thank you very much for this little bit of it. Then what we do after this one is we do a histamine challenge. Some people have mastocytosis and other allergies or allergy states, and the mast cells get released. They release histamine. They make you feel sick. They give you rashes. They do all kinds of things. So we need to make sure that you're not allergic to fermented food. Fermented food is probiotic. It has live bacteria in it. Pickles, kimchi. In this diet, you don't want to do yogurt because you want to eliminate dairy. But otherwise, you're going to do a challenge with, say, pickles. If you get a big inflamed belly and a bunch of diarrhea, you go on an antihistamine diet. And that's too big of a diet to talk about here because it's complicated and it's hard to be on. There's a lot of foods you can't eat. It's a little bit sad, but you'll feel better. So for you, it's happy. Okay. And then after that, the diet that you want for life is going to be the low glycemic diet. We'll go ahead to the next slide. And you'll see that the typical American diet is not very great for us to stay healthy and eat without getting diseases from eating. So it's a little bit complicated, and I didn't do this in as great as color as I wanted. Let's see. So at time 0, you eat a meal. Okay, so what do you eat for breakfast? Oatmeal. You think that's healthy with a banana. It's actually high carb. It's not low glycemic. It triggers your pancreas to release insulin. And that's exactly what we don't want to do. So once you eat that, your insulin level goes up. It shoots up, and it kind of stays up until you eat a snack or lunch, and you have that hamburger and French fries. Whoa, there's a lot of carbs in there. So guess what your blood sugar does? It goes up. Eating oatmeal is like eating 2 teaspoons or tablespoons of sugar. Eating a hamburger actually is sugar to your bloodstream. Your pancreas will secrete insulin to try to bring it down. And then dinner, you're going to have that steak with mashed potatoes. Maybe you'll have some ice cream or pie for dessert, coffee with sugar in it. And guess what you do again? You trigger your pancreas to release insulin, and that's when you get insulin resistance. When you get insulin resistance, you're pre-diabetic. Diabetes is not fun. Okay, so I want you to consider, and I do believe that diabetes is a cancer of aging. It's going to take away your eyes, your kidneys, a leg or both legs. Your kidneys are a lot of people think, well, I'll just go on insulin and then I'll go on a list and try to get a kidney transplant. Or actually, so they do that and they go on a list. It takes a while and then they get dialysis. Talk to anybody who has to get dialyzed 3 days a week for 4 hours at a time. Almost everybody gets a really bad headache. Almost everybody's really tired. And the family really considers and sees that they're kind of not good for much. Can't do things, can't go places. You have to go get dialyzed. It's not a great quality of life. And then you get all happy when you finally get your kidney. But guess what? You're going to be on steroids and anti-rejection drugs for the rest of your life. And if you catch pneumonia, you'll probably die in an ICU. And it's not an easy life either. So you don't want diabetes. You don't even want pre-diabetes. Okay, so when you get to the point where you're almost pre-diabetic, you have to consider that you've been on a boat your whole entire life going to an island of diabetes. If you want to stop going to that island, you can turn the wheel and start turning around, but guess what? You're going to be going uphill. It's going to be hard. It's going to take a long time. Your brain is going to have to reset. You're going to have to put forth a lot of energy. You're going to have to really, really, really want to do it. And most people don't really, really want to do it unless maybe they had a family member that died of diabetes or a silent heart attack. Because you get neuropathies in your chest and you can't even feel it when you have a heart attack. So the low glycemic diet is the diet for life. And it will help you prevent prediabetes and diabetes and keep your pancreas working. That's what you want. You want a pancreas that works for the rest of your life. And those are really the basics. So I encourage everybody to do the Whole30. It's free. It's, do your homework. You have to really want to do it. And let me know how you're doing after 30 days. Because I think pretty much everybody who does it, who's done it, who's told me about it, they do it together with their husband or wife. They do it with whoever's living in the house. Everybody feels better, not just the people who have pain. So I think our American diet leads us down a wrong way for chronic pain. And it takes a lot of education and learning to understand that chronic inflammation is what you have if you have a lot of pain. But there's still a lot you can do about it. And you don't have to be hungry. You don't have to weigh your food. You don't have to count your calories with any of these diets. You just eat what's on the menu. And like the Whole30 organization teaches you how to shop, how to cook, what to order at a restaurant, how to order out if you're working, and many times you have to take your own lunch. Take your own lunch, get your own snacks. You learn the portions that you can eat and the portions that you shouldn't eat, and you feel better. That's like the best part. So when you're on the low glycemic diet, you can see from this slide, you eat and your blood sugar doesn't go up. Therefore, the pancreas hardly has to release any insulin at all. It never goes high. And then you can have a little snack in between, but you won't raise your blood sugar and you won't raise your insulin level. It's like invisible. Stay below the radar. Lunch and dinner. You've got no hyperglycemia, no high blood sugar. Your pancreas is resting, your insulin level's not high, and you'll live longer. And you'll change your body composition. And that's a diet for life. I actually test insulin levels. And a lot of doctors don't even know you can do that. So it's really something that's been designed for a long time. You'll see even on Pinterest and Twitter, every food is assigned what's called a glycemic index, and it's a number. So say an apple is low, spinach is low, and ice cream is high, and pie is high. It has a number to it. And then you just look at the numbers. Oatmeal's medium. The steel cut oatmeal is lower. So you want to stay away from the medium and high glycemic diet foods, and stick with the low glycemic foods and eat it. And don't be hungry. And don't cheat, except maybe once in a little tiny while, because we're all human. And you can cheat with a bite or two and not feel like you just ruined the whole thing and you have to just eat the whole pie. Okay, so don't be too hard on yourself, because I think that's something that we all have a tendency towards, just being a little bit too hard on ourselves. And try not to do these kinds of things on your own. It works much better if you've got a supportive system, if the other people in your house are going along with it with you too. That's a really big help. Otherwise, be yourself, determine that you want to do it, and set your mind to it. Read about it. There's a lot of books, a lot of groups. It's really mainstream. And I think it's one of the best things that people that have pain can do, because it's kind of free in a way. You have to buy food anyway, so you may as well buy the kind of foods that are going to make you feel better from the inside out. And so the bottom line is that when you go on a diet, you need to make good choices every minute of every day sometimes. But translate that into something good. You're investing in yourself. You're investing in your future. You're cutting down your pain. You're cutting down your risk of heart attack and stroke. That's still the number one cause of death for men and women. When women are sort of raised to fear breast cancer, well, 7 times as many women die of heart attacks. So I think it's better to live longer and to have quality of life and not have so much pain. And each one of these decisions that you make to put something in your mouth builds you or breaks you down from the inside out. So invest in yourself. Decide you're gonna, you know how you feel when you decide you're gonna buy yourself a new car? Well, guess what? When you buy yourself a new body, you buy something that will not wear out. It won't get rusty. The more you use it, the better it'll be, and you'll be happier. So I know that a lot of times food is comfort. Comfort foods make us feel better, especially when we're by ourselves. So try to get comfort out of eating things that are going to help you. Because I think if you do the Whole30 for 30 days, you'll let me know that you did it and that you feel better. And I'm very optimistic about that, because I think it's not hard to succeed at this, because you can eat what you want without counting calories. And that's like a nice, good feeling. So thank you very much. And I guess we can answer some questions, and I can talk some more about any of these things. It's been a really big... Oh, go ahead.
Hi. I was just had a few questions for you. I have a health condition where my body doesn't stop producing adhesions in my abdomen. They just continue to grow. Is there a particular food that can cause that? Is it an inflammation? Is it autoimmune?
And you're saying these are adhesions?
Oh, yes, ma'am. I have been battling this since I was 18, and in 2007, they refused to do the only treatment that's ever helped, which is removal of the adhesion. When it completely stops my bowels from moving. Everything is just basically displaced and mashed up in a big ball. They can't even navigate in there. I can't eat anymore. It's caused gastroparesis. I've been surviving on 4 ounces of milk a day since 2007.
Wow.
So my food
what is the
intake
diagnosis?
is not good.
What are they giving you as a diagnosis?
Abdominal adhesions.
Okay.
And of course, it's caused gastroparesis, and my intestines are paralyzed. They literally don't move. When they do try to move, it yanks on the adhesions, and it causes more trauma.
Well, that sounds like an unusual problem. It's not seen very often, so I don't know what you would need to eat, or if you could eat. I would have to know a lot more. Gastroparesis, we can talk about that.
Yeah, when I got so bound up that then the gastroparesis was diagnosed, since then, I've tried different foods, like a spoonful of spinach or a spoonful of potatoes, a spoonful of whatever, and just a teaspoonful will blow my abdomen out like I'm 9 months pregnant within 5 minutes, and then projectile vomiting hits.
That's really severe gastroparesis. When I had my
horrendous.
Yeah, I got you. Okay, thank you. So we can talk about gastroparesis. I don't really know what syndrome you have or what it could be that way, but for sure, a lot of patients have gastroparesis without knowing that they have it. So if you get full fast, if you feel like nauseated or feel like vomiting, if you eat too much, if you feel like the food is coming up your throat, if you eat too much, it's like building up and you can't keep it down, it could be because it's just staying in your stomach. If you feel like you eat a hamburger and it stays in there for a week, that's probably gastroparesis too. There's a couple of studies that can be done for that. One is the upper GI, where they go in with a scope down the throat and look in the stomach. I've actually heard of a patient who had a bezoar, pretty much a ball of solidified conglomeration of different things that just sits in there like a rock. So what can you do about that? The only thing that it's not my specialty or anything, but I know you can eat papaya enzyme. Papayas have enzymes in them that break down food in the GI tract. So the problem could be in the stomach itself or the pyloric sphincter. There's a open and closed door that keeps pressure shut. So sometimes it doesn't relax enough to let the food through the stomach to go into the intestines, but once it gets there, it might be okay. But most of the time, gastroparesis hits all 27 feet of intestines that you have in your belly. Also, it's worth mentioning that the GI tract is responsible for about 80% of your immunity in fighting infections. So if you have a problem with gastroparesis or any problem with your GI tract, it could definitely affect your immune system and develop into something autoimmune. There's also some tagged radioactive food things that you can eat, and the doctors who specialize in this can test it and see how fast it goes through your system to try to give you a grade of how bad the gastroparesis is. There are also drugs that are pretty easy to give and pretty well tolerated that can increase motility and allow food to move forward. Probably the most common one people think about are erythromycins or Reglan or metoclopramide. That's the name of it. So they propel the stomach and the intestines forward and help you digest your food that way. And I'm really sorry that you can't enjoy foods. It sounds like you're really, really restricted. It sounds like they can't even feed you through a tube into your small intestine and bypass your stomach completely. So I'm really sorry. It's perplexing. I don't know what to do for you. I'm not familiar with that. Fibrosis and adhesions are very difficult in the abdomen because there's structural barriers that make the intestines stick to one another in different ways, and it's really hard to go in and just break it all up surgically, because then you suffer the post-operative recuperation too. But it sounds like you've lived a long time so far, and you've dealt with this for a long time. So I'm grateful for that. Otherwise, I don't really know.
Hi.
Do we have another call?
Can you hear me?
Yes.
Okay, Dr. Aranda, maybe you can contribute to what I've learned so far about fennel seed. It's kind of a funny story. I got a pizza from a grocery store deli, and immediately, being from Chicago, noticed there was no fennel in it. They had totally botched the recipe. And the pizza isn't pizza until you put fennel in it. Well, I took some fennel and sprinkled it on, and I didn't digest it at all. I immediately bloated. I had been bloating for the previous 5 years after eating anything, and this was really bad, and pizza was one of the things that went down. I got some fennel seeds and started chewing on it. Then I started researching it and found it's an old Indian digestive stimulant. I have been miraculously cured of all bloating. My waist functions returned to normal for the first time in 5 years. Can you add to what I've learned about fennel seed? Thanks.
Well, it sounds like you were pretty good at figuring out how to fix that. That's really good. You know, sometimes the doctors really don't specialize very much in food. You almost have to go to a nutritionist. It's really sad that we don't get more training in nutrition. When I went to medical school at Oral Roberts University in Tulsa, Oklahoma, that was in the 90s. We were the only medical school in the country that had a nutrition class. So a lot of times we end up relying on nutritionists for a lot of data, and ideas when it comes to a particular patient. And I wish we knew more about it.
I've been pursuing, what the herbs and spices can do over the years, and vitamins too, for a long time. And I did get this food poisoning, and we called it after that post-infectious irritable bowel. And I didn't know what to do about it. Let me see, I was Alka-Seltzer, stuff like that. And the trauma of this unfennelled pizza caused me to read up about it, and I've said, maybe these things aren't going down because fennel is so effective. Well, I've been chewing some before a meal and some after. I'd call it a quarter teaspoon. It tastes like licorice or anise, and it's not unpleasant, but sits there a little grainy. But I have had zero bloating, zero problems. Waist has been perfect ever since, and I don't apply to hype or miracle cures. And I'm very medical, as Janelle knows. I love Dr. Klein and stuff. Anyways, I just had to say that I'm going to continue to watch the show. Thank you.
Oh, thank you so very much for watching us on Keeping You in the Family. It's amazing how many GI problems exist out there. And it's really good to see that people research things themselves and try different things. And that all contributes to good information for other people too. So I really think that diet and food are super important. And I think I got lost. Oh, wow. There we go. So thank you so very much for being here with us. It's great to field some questions too. The other thing that I wanted to say too is just give you a little bit of my own personal information. I was 19 when I had my first baby, and I was 42 when I had my second baby. And it's much easier to have children when you're young. I gained weight with both of my children, and pregnancy carries a lot of concerns on its own as far as eating for two kinds of things, and breastfeeding afterwards. You have to have good nutrition. But it took me a long time to lose my baby fat from the second child, whereas in my first child, I lost weight pretty much right away. So I did use the low glycemic diet to help me lose the weight. I'm still on the low glycemic diet, and I've been on it for about 16 years. So it's not a new diet. It's something that's been out there for a long time. It's been tried and tested also. And so it's definitely something that doesn't take away your entire quality of life. And it can definitely make you feel better. The other thing is that no matter what you eat, you're going to gain weight if your expenditure of energy doesn't equal what you eat or exceed it if you want to lose weight. So we're not talking about you can eat whatever you want and not gain weight. If you eat too much of any kind of diet, you're going to gain weight. And especially some of the diets where you're allowed to eat a lot of meat and eggs, probably your cholesterol will go up and you'll have other problems. So I think one of the main things is that all these diets and all these different things that exist out there to lose weight really work better for you if you are able to go ahead and do some exercise. And I'll tell you the great news about exercise. The great news about exercise is that you don't have to work out anymore. You don't have to work out for 30 minutes, 4 times a day. There's no rules anymore. You're exercising if you sat on the couch all day, every day, and now you're getting up and walking around the house 5 times. That's exercise for you. So it doesn't matter what you do. It doesn't matter how often you do it. As long as you're doing more than you did before, you're going to build muscle and you're going to, feel better and change your body composition. So it's that also, I think, is something that's very lighthearted and good newsy for people who hate the thought of going on a diet. And so I want you to get used to the idea that going on a diet is spoiling yourself. It's giving you something that's going to make you better, younger. It's going to help you feel better from the inside out. It's going to change you. And I'll say that people ask me about my skin, my facial skin. I'm not wearing a lick of makeup, nothing, zero. The only thing I have is some eyeliner that I tattooed. I had somebody else do it for me. And that was when I was in medical school. That was like 30 years ago. And it's still there. Otherwise, I don't wear any makeup. So why is my skin so good? I'm not so sure exactly. I don't use hardly any skin products. But I eat really healthy as much as I can. And I do drink a lot of water. For me particularly, I had dysautonomia and the traumatic brain injury with diabetes insipidus. So I lost more water than what I could keep in. And I almost died from that a few times. So water, and I was on a PICC line IV for 3.5 years. And fluid and salt were something that I craved and something I had to have because my body couldn't hold on to it. So I tried every single water that's out there. I tried flavored water, vitamin water, any all the water aisle, all the water aisles that the water vials, the bottles that are on the aisle. There's like so many choices. I tried every single one of them because I literally had to have a bottle with me every day, everywhere. It was my lifeline because I otherwise would go back on a PICC line. And if you don't know what a PICC line is, it's an IV that goes in your arm. It goes like in the antecubital area over here, and it weeds up across underneath the shoulder blade. And at one time they were putting it in, and it went up my head, and it poked me in the forehead and side. And I'm like, get out, get out. So they pulled it back down and made it go to the other side, and it sits right at the top of the heart just before the heart is pumping, all the blood in. So that filled my heart with some water. And it's hard to be on a PICC line. It's really hard. So it kept getting infected, it kept getting clotted. It was just such high anxiety. So finally, when I almost died, when there was nobody to fix it, I said, I'm going off of it. And I drank more water. And I went from 60 mLs an hour to 59 the next day, to 58, to 57. And in 2 months, I was on like less than 10. And we took it out. And it stayed out, thank God. So I still have to keep my water bottles with me all the time. I'm still very heavily dependent on it. And you can criticize me if you want. But I drink, bottled water a night in a glass. I can't drink really out of plastic, and it has to be mineral water. I need the minerals. So, everybody's different. I invest in that for myself. And it's my lifeline. Anybody who knows me knows I have water all around me. I can't live without it. And you're not allowed to drink my water unless you ask me first or unless I give it to you. So, we all have our quirks. So water's really super important with everything. And I think that's one of the reasons why my skin looks good too, because I drink a lot of water. And I just want to compliment you. I know there are a lot of people in a lot of pain here. I'm not trying to minimize your pain. I know how bad things can be, but you should have hope, and you should be enlightened and optimistic and hopeful that if you do something like investing in yourself with weight loss and with a diet, a really, really good diet that makes you feel better and treats your pain by cutting your inflammation, that's a whole door that opens up a whole new life, and most doctors don't even tell you about it. I mean, I also think that if you go to a doctor who's heavily overweight, that doctor is probably not able to tell you very much about how to be in a good weight, in good shape that way. So I think that it's important for me to be a good example for you and to practice what I preach. And like I said in the first show that I had with Jonelle, diet saved my life. And I had to go on it really strictly, not so much because somebody gave me a cheerleading talk about it and how good it would be for me, but because I had no choice. I couldn't get out of bed. I was in bed for 12 years. And I don't know anybody that's been in bed for 12 years. So I think you can tell that I suffered a lot, and that my story hopefully inspires you and your family, because if you can do this with the help of your family, that totally will empower you. That makes a big difference. If you can get your spouse, your partner to agree to do the whole 30 days, and you can do it together, you're going to succeed. You're going to feel great. You're going to feel like you wish somebody had told you about it before. So I want that for you. I try to buy as much organic as I can. I shop at Costco. Nobody owns more organic farmland than Costco. And a lot of people don't even know that. So I think that it's important for us to realize that too. Organic food doesn't have to be super expensive. It's not just for the rich. It's not just for doctors' families, and I didn't come from a family of doctors. So I think that if I could do it, most people could probably do it. You just have to take the money that you have and redirect it to things that are more healthy for you. I mean, McDonald's may be $5 a meal, but it's killing you. It's not helping you, it's hurting you. So don't hurt yourself. Invest in yourself instead. Go buy some little teeny tiny Maine wild blueberries. Those are one of the most anti-inflammatory foods that you could buy. Buy them frozen even. Throw a frozen banana in there with some milk and make yourself a smoothie with some protein powder. There's all kinds of protein powders with collagen and a lot of other things that are good for you. And not that you should live on smoothies. I'm not saying that either. But you can spoil yourself. It tastes just like a shake. If I served it to you, you would think it was a shake. So a lot of times there's just not enough imagination, and we can make really great food with 4 or 5 ingredients, really basic things, and it can actually be exactly like taking a pain medication. And if you ate as if you were eating for pain medication, and if I could convince you that it would help your pain and you would feel a lot better, I think most people would give it a try for 30 days. So I challenge you to go ahead and do that, and then let us know how you did. You can email us at info@Aranda MD Enterprises. You can call our 800 number at 992-9280, and we would love to have you set your 30 days. You can let us know you're setting when you're going to start your 30 days. You can let us know when you finish your 30 days. You can let us know day 31 how pickles or a kimchi or a 3-bean salad did for you. And you will be opening a door to a new life. And I don't say that lightly. You'll be investing in yourself. You're buying yourself the best car that you could ever buy yourself, because that's your body. And, we only have one body, and we have to take care of it. And the great thing is that God made our bodies so that the more we use it, the better it gets. So one choice at a time. Put stuff in your mouth that helps you. And I really challenge you to do that, because you'll be making the best investment you could ever make. Because sickness costs money. Heart attacks cost money. Strokes cost money. All these different things that can happen. Fatty liver costs money. I'm not saying that just because you have a fatty liver, that means you ate wrong. Okay? All I'm saying is that you are actually in control of quite a bit of your longevity, your daily health, your daily pain. And if you ate like it was medication and made sure that it was anti-inflammatory, I think that you would be hooked for life. And you'd never go back to the way you used to eat, because that's what most people say. They're never going back. They're just never going back. They don't want to ever be like that again, because they didn't feel good. They thought that eating was comfortable and it was comfort food to them, but it really wasn't, because it was hurting them. So I hope that helps you. I never had anybody talk to me quite so much like this. And the only reason that I'm able to do it is part of the reason why we chose keeping you in the family as our motto. Because I lost my family. I lost my house. I lost a lot of things that the world thinks is, are important. I've learned to live a lot more simply. I care about really basic things in life. And I think it helped me be a better person and sort of resurrected me to be a better doctor. I don't think I'd be sitting here in this chair today talking to you about this if I was eating the same diet I had 15 years ago. I would have died. And I think that it's important that I'm here to tell you what helped me, because I want you to stay in your family. I want your house to be happy. I want you to feel good about who you are. I want you to have less pain, and I want you to do every single thing in your power that you possibly can do to have less pain. And if you have that much pain, you should be doing this. And I really mean that, because there's no reason for you to have quite as much pain as you do if you're eating poorly. And you'll notice a difference. You'll feel better. Your body will thank you. I think that this is probably a good time to wind down a little bit. And thank you for being here again. The next time we meet, we're going to talk about sleep and insomnia, because I want you to sleep 8 hours a night, 6 to 8 hours every single night. You'll be a different person when you sleep. And so a big thank you to our audience for taking some time out of your evening to join us here on Keeping You in the Family on CAW360 Network for your daily dose of truth. And this has definitely been your daily dose of truth. A reminder that the DPP rally talk show with Claudia, I'm so sorry, it will be canceled on Sunday. But please subscribe to CAW360 Network's YouTube channels for reminders of when we have live shows. I'm Dr. Margaret Aranda, and thank you for joining me this evening on Keeping You in the Family, and wishing you a good night, and thanking you for being here.
Thanks for joining us for Keeping You in the Family. This program copyright 2019 by Dr. Margaret Aranda and CAW360. All rights reserved.